I've been working in this field for approximately 10 years, maybe a little over a decade now. And initially it was all about flow. And we would have flow teams and flow projects and would measure something. And it frequently measured success for something. But with all of these projects that measured flow, we never saw much in the way of throughput. The reason for that is simple. When you have a flow project, oftentimes you optimize one part of the system at the expense of another part of the system. So depending on what you measure, you can show a lot of improvement, but not necessarily moving patients through the organization in a smooth, efficient, effective manner. So I've started to think about throughput now as the most important concept when it comes to, if you're going to say it right, flow. Now, here's the thing. If in fact you can't see more patients with the same number of beds you have, which means you're basically taking some of the waste out of the system, well, then you really haven't improved the throughput at all. If you're overbedded in your organization and you haven't taken advantage of the fact that you're overbedded and you've made adjustments to the size of your organization, well, then you're going to pay the cost for it. That's because you haven't looked at throughput. What you've looked at is just flow. So those are two of the buzzwords that I think bear some thinking and working around as far as doing improvement work in this area. When I first started working in this field, it was all about projects. It was all about, we're going to do a discharge project, or we're going to do an admission project, or we're going to do a transfer project. And in spite of the fact that these pieces of work may have been successful in their own right, we never solved the problem from a system perspective. That's all we did is optimize one area at the expense of another. So what I'm seeing now is more and more consideration for the system and what needs to be done with a system in order to make improvements in the care for the patients that we hope to help.